Dr. Bill Morrison, Associate Professor of Educational Psychology, Co-Executive Director of Health and Education Research Group, Faculty of Education, UNB Fredericton, President-elect, NB College of Psychologists.
Largely our research, or my research, is focused on school health and has been since 2002. Our interest primarily is on applied research that makes a difference in terms of policy and practice. So with an interest in students and families and communities, and in particular on what makes quality of life for these students, what contributes to resiliency or strength. Initially, when I first started research, we focused on school health, and we actually looked at tobacco control. We were looking at risk factors associated with what places people at risk to smoke or to use tobacco. And that was our early days, and we looked at a lot of risk factors. And over the course of the years, we expanded our work in health research to actually look at health eating, physical activity, and finally mental health and positive mental health. One of the really highlights, I guess, of working at Health and Education Research Group, starting in 2006, we actually followed 40,000 children and youth in New Brunswick through the New Brunswick Student Youth Health Survey, New Brunswick Wellness Survey that we created in collaboration with the government of New Brunswick. And we followed students over the course of time, not just looking at risk, but also protective factors. And what we're really excited about is that survey, that feedback system has now become part of government. So the surveillance of youth health behavior has become part of decision-making processes. So we're excited about what's happened there. We've had a chance to work with the government in identifying things that will be useful for informing practice and policy. So we're interested in practices that actually create positive mental health environments. And that's probably the most exciting thing we're currently involved in and working not just in New Brunswick, but across Canada. Having an organization such as the Brunswick Health Research Foundation provides opportunity for promoting applied research and evaluation. It means that researchers are not siloed or in these grand institutions but have no relevance to the community. When we have a chance to actually promote what's happening, we realize there's so many good things working together. And really what that means is that dollars can be used meaningfully. They can be targeted toward things that are important in terms of quality of life in New Brunswick. They can address areas of strength and capacity of our youth, children, and families. So I think it's important that we have organizations such as that.